Supportive supervision of supply chain personnel. Meet Jada. Jada is a district health officer with years of experience in providing supervision to public health supply chain personnel. Jada is going to help demonstrate how supportive supervision can help improve the performance of health facility staff in undertaking their supply chain responsibilities and improve services to clients.
When using supportive supervision, managers teach, motivate, and collaborate with facility staff so they're better equipped to deliver health products to clients.
Effective supportive supervision has a positive impact on performance and can even save lives. During the visit, staff should be empowered with new information and skills to improve their supply chain performance. By establishing performance objectives, health facility staff are motivated to work toward their goals. Supervisory visits are an efficient way to solve small problems before they grow into larger problems which might affect product availability. Unlike other forms of supervision, supportive supervision is not hierarchical. It encourages supervisors to listen more than they speak, interact as colleagues first, then as a boss, inspire positivity and staff commitment to success. A good supervisor like Jada will always prepare for a supervisory visit, bring all of the tools needed for a productive visit, review logistics records and reports, check storage conditions and review stock levels, make an action plan for ongoing improvements, follow up on the progress of the action plan at the next supervisory visit, if not sooner. To prepare for a supervisory visit, study the supervisory report from the previous visit to familiarize yourself with the unique strengths and challenges within the facility. Be sure that facility staff are expecting your visit by scheduling and confirming your appointment. If possible, bring an extra supply of important medicines and forms that the facility may run out of. Throughout your visit, use your checklist to document the strengths and weaknesses of the facility. Checklists, such as this one, are commonly used to assess facility performance for commodity storage, record keeping, reporting, and monitoring of stock status. It is important to meet with the right people during a supportive supervision visit. The supervisor should meet the facility in charge as well as the people performing the supply chain tasks, such as the storeroom manager. At the beginning of the visit, listen to your colleagues to understand what has happened at the facility since the last visit and any difficulties the staff are having. Let's listen in on Jada and her colleagues as an example.
Thank you for joining me today, Elizabeth and Carla. What updates do you have for me? I remember in my last visit, you didn't have enough storage space for your medicines.
We're doing well. We recently cleaned out all of the expired medicines in our storeroom, which cleared up lots of free space for our products.
What else?
Many people are sick with malaria, so we're running low on malaria medicines.
Thanks so much for sharing. When we go to the storeroom, we'll look at that issue.
Be a good listener and ask for the opinion of the people you supervise. They are the local experts and may have a better understanding of how commodities move through their facility. A supervisor should review logistics records and reports together with the facility staff. The supervisor should encourage staff to communicate any difficulties or confusion that they are having in filling out their forms correctly.
I noticed there's a couple of errors on this form. Are you having trouble using it?
Yes, I don't always have time to fill this form correctly with all of my other duties, and sometimes I don't understand the purpose of all this paperwork.
I understand your frustration. Your role in data collection through reporting is very important because these numbers will determine how many commodities your clinic will receive and ultimately inform the quantification process for the country in the future. Let's review the form together, and I'll give you some tips on how to save time completing it.
Thank you. That would be helpful for all of us.
Try to maintain open two-way communication between a supervisor and their staff. Don't forget to recognize staff for the tasks they are performing well. Positive reinforcement will motivate staff to continue performing well in those areas. Visiting the storeroom to check storage conditions and review stock levels is a key part to any supervision visit. Check to make sure that the staff are following good storage practices. Are the products in good condition, well organized, and free from harm? Is the room clean and well ventilated? And are expired products kept separately? Check to see that quantities are being correctly recorded on the stock card and that losses and adjustments are being incorporated into the balance. If errors are spotted, ask the store manager to demonstrate how they made the calculations. Show the correct way and emphasize that it is always important to check the math with your calculator. Remember, errors are teaching opportunities for supervisors. Staff errors highlight topics that you should review during your visit. If needed, supervisors can conduct short on-the-job training sessions during their visits. Choose a few important medicines and jointly conduct a physical count of them, comparing results with each of the stock cards. Before leaving, Jada is sure to make an action plan for ongoing improvements. Working with facility staff, review the goals and action plan from the previous supervisory visit and identify barriers that staff encountered. Then, jointly develop a short list of recommended actions for staff to take in order to meet the facility's goals.
Elizabeth, what things would you most want to improve before my next visit?
I want to make sure that my staff understand the importance of filling out LMIS forms carefully. So, before your next visit, I'll hold a review with my staff about how to complete the LMIS forms correctly.
Those are great ideas. What else?
We will make sure to check the expiration date of products every time that we conduct a physical count so that we can avoid storing expired medicines.
The information from the action plan will feed into Jada's supervisory report for her visit. She will use this same supervisory report to follow up on action items for her next visit. Don't let lack of resources stop improvements. Work together to come up with creative solutions to supply chain problems that require few resources. As you wrap up your visits, keep in mind that supportive supervision visits should occur at least quarterly. Plan to return at regular intervals. Jada is a great example of a supportive supervisor because she prepares for a supervisory visit, brings all of the tools needed for a productive visit, reviews logistics records and reports, checks storage conditions and reviews stock levels, makes an action plan for ongoing improvements, and follows up on the progress of the action plan at the next supervisory visit.
Supportive supervision is more than just checklists. It's about teaching, listening, and positively supporting your staff so they can do their jobs better.
For more information about supportive supervision supply chain activities, you can access the document Supervision and On-the-Job Training for Supply Chain Management at the Health Facility online here at